Welcome back to the Legislation Podcast and YouTube broadcast, episode number 5. House Bill 495 again, but dispensing practitioner status. Restoring common sense in dentistry is what we're calling this. And we begin our podcast and YouTube broadcast right there.
Welcome, all of you fantastic dental podcast listeners, to the My Practice, My Business Dental Podcast Show, where we help dentists profit and thrive with excerpts from the clinical business of dentistry training here at My Practice, My Business. We'll be addressing and answering questions with current trends dentists and their teams face each and every day in their pursuit of this wonderful career we call dentistry. And now the host of our show, the clinical director and president at My Practice, My Business, Dr. Rob Thorup.
Imagine that being told that handing a patient a bottle of Prevident toothpaste or chlorhexidine rinse is suddenly illegal.
That's exactly what happened in Utah a few years ago, and it sent shockwaves through the dental community in offices across our state.
But don't worry, in 2025, Utah fixed it. And today we're explaining how House Bill 495 officially recognized dentists as dispensing practitioners, restoring both clarity and sanity to dental care. And it all started around 2023. A new law was passed in Utah outlining who could legally dispense medications. Pharmacists, physician's assistants, physicians, nurse practitioners, all listed. But guess who wasn't? Dentists.
That simple omission, it caused a lot of chaos. Dentists started getting calls and even visits from the Department of Occupational and Professional Licensing, known as DOPL, and telling them that they were dispensing medications illegally.
Even common items like Prevident and chlorhexidine, both manufactured, packaged, and labeled, suddenly became a compliance risk. Offices were terrified of being fined thousands of dollars.
The irony behind this, dentists had been doing this safely and ethically for decades. This wasn't about misuse, it was about oversight. And it's just a simple error that had huge implications.
So credits where credit's due. The Utah Dental Association recognized how serious it was. We actually saw the executive director at the Capitol. He had been meeting with legislators and started that conversation to fix it.
It took months. Months and months of discussions, revisions, clarifications, but in 2025, Utah passed House Bill 495 and officially adding dentists to the list of approved dispensing practitioners.
So this one sentence addition to the law made the world of difference. It brought relief, compliance, and clarity back to hundreds of offices.
It just simply made it a safer place. So what exactly does this mean? Under Utah law, dentists can now dispense medications that are prepackaged by a manufacturer or a supplier.
Now, it has to be a 30-day supply or less, with one current exception, fluoride. Because of the ongoing national conversation about fluoride right now, the state left some flexibility there.
And the key takeaway is that this law applies to anything dispensed, meaning medications that's given to a patient for home use.
And that really brings up a very important distinction that we want to make sure that we clarify: the difference between dispensing and administering.
What's dispensing?
Dispensing is when you sell or provide a packaged medication for the patient to take home, like Prevident toothpaste or chlorhexidine mouth rinse. It's a resale or a handoff situation.
Administering is something we do all the time. It's when we deliver a medication in the office as part of a procedure. And think about anesthetic injections or pre-med antibiotics given before treatment, or delivering an antimicrobial gel like minocycline or a powder like Arestin. We do that all the time in our offices.
So dispensing requires a dispensing license through DOPL because you're acting as both a provider and the pharmacy in that moment. Administering doesn't because it's part of the treatment.
It's a simple distinction, but one that's critical for compliance. And we're happy to help any office that needs guidance getting their dispensing license here in Utah. But think about it. What about in your state? Have you checked the laws in your state? Are you allowed to dispense?
Double check on that one. For us, this law is about convenience, compliance, and patient care. So it's about letting dentists provide simple, beneficial products to patients without the fear of being labeled as illegal dispensers.
Or a drug dealer?
Drug dealer.
Okay. It also protects public health because when patients can walk out of your office with what they need, they're more likely to follow through with that care.
So I call this common sense reform. It's the kind that restores the trust between the providers, regulators, and the patients.
And if you're a Utah dentist, make sure you're compliant. Get your dispensing license if you plan to resell any items like Prevident or chlorhexidine. And if you need help, again, reach out to us. We have the process, the forms, and the guidance all ready to be applied to anybody who needs this. And if you're in another state, take note. This kind of confusion can happen anywhere. Adding dentists to a list of dispensing practitioners should be standard nationwide. Unfortunately, it wasn't here in Utah.
At My Practice, My Business, we're always happy to share our experience, legislative language, and compliance tools. We're just a phone call or an email away.
Follow us on social media and subscribe to our podcast and YouTube channels. Stay tuned. Next week, we're going to dive into another Utah law that keeps dentistry fair, ethical, and patient-focused. Until then, thanks for being here.
Thank you for being with us today. Since 2006, My Practice, My Business has been teaching dentists and their teams business skills, dental insurance contractual protocols, and state laws governing how to profitably bill patients fairly for the need-based services they provide. What's more, we guarantee our training, unlike other dental consulting companies in the industry. Simply stated, if you don't increase your net revenue, we don't get paid. We call it dental consulting the way it should be. We believe there has never been a more important time than now for dentists to experience and implement our key methods, knowledge, and business training within their dental practices. To learn more about our guaranteed, no-risk clinical business of dentistry training that is changing dental practices for the better, just go to our website, mypracticemybusiness.com, and surf our pages for additional information about our company and the services we provide. When you're ready, give us a call and get scheduled for the most profitable dental business training that you will ever experience. If you enjoyed our podcast, please leave us a 5-star review. If you have any questions, please don't hesitate to call us. Thank you again and have a fantastic day.